So, good afternoon once again. My name is Helena and I will tell you something today about all you need to know about IVF treatment abroad. So, if you have any questions, you can write in the comments on our Facebook page, so we will try to answer all your questions. We got already several questions, but I will first start with some information general. So Unica Clinic was established in 1991, and then in 2017 we opened the clinic in Prague. The first was opened in Brno. So we have two clinics in the Czech Republic, and for you from abroad it's a big opportunity because we are in the center of Europe and you can reach us very easily. In Prague there is one airport, and near Brno there is Bratislava Airport or Vienna Airport. From these cities you can reach us very easily by RegioJet trains or buses. Or of course you can come to us by car as well. So I have here several questions. So the first question is what to do if I want to order for initial visit. So first of all, you will write us an email or you can contact us by phone. You can find our contact telephone numbers and emails and so on our webpage, and we will answer you very soon. We need from you to fill in the online questionnaire where we will ask you several questions regarding your health conditions and so on. And you will also create patient zone online, which you will use later on. Then we will need from you that you send us your medical results, such as TSH, prolactin level, or AMH, FSH, LH, the blood tests, pap smear, and many other ultrasound examinations and any other results that would be necessary to evaluate with the doctor. You can have the initial discussion with the doctor in two ways. Either remotely per Skype, which is for you convenient that you don't need to leave your home, or you can come personally, which you have to travel, but it has also advantages because you can pick up the medicaments immediately after the initial visit. The doctor would make you ultrasound during the visit, and you can also read all the documents, sign the documents, and so you can be prepared better. But if you do the Skype, you don't need to travel, and we can do everything via emails. We can send you a prescription per email, it's also possible, and you can go to ultrasound in your country. How many visits is necessary during the treatment is another question. It depends what kind of treatment you would like to have, because we have several kinds of treatments. Your own stimulation with your own eggs, or treatment with donated eggs or donated sperms, or cryopreservation, your own eggs or sperms, or donated embryos. If you would like to have your own stimulation, then it's good if you come for the initial visit here personally, because the doctor will make you ultrasound. If you can't, then you can have the first initial discussion remotely, and after that we would invite you sometimes around 21st day of your cycle to us, again for ultrasound, to pick up the medicaments, to get the treatment plan. This is such a kind of sheet where you can see when you will take any medicaments, in what dose, and so on. Then, if you start the treatment, it begins usually with the first day of your period, you start to apply injections. We are talking now about your own stimulations, and approximately after a week, you come to us to the first folliculometry. It's kind of ultrasound, where the doctor is observing the follicles, how they are big, how they are growing, and according to this, he decides about the next steps. Then usually a couple of days later, 2 or 3, you are invited for the second folliculometry. Again the same, and then usually the doctor decides when will be the egg retrieval. It's again several days later. Then you come for this egg retrieval with your partner to retrieve the oocytes and for the partner to give the sperm. The oocytes are on the day fertilized, and 5 days later is transfer. If you want to have egg donation treatment, then you don't need to come so often. Practically, the man just at the day of egg retrieval of the donor, and the woman just for transfer. This is minimum of visits. In case of cryopreservation of your own oocytes, this is the program social freezing or egg banking, then this is the same like with own stimulation. Then we have here another question. I will be 48 in November. My period has stopped about a year ago, but I'm still ovulated according to my GP. Can I still be pregnant? Is there any chance to become a mother? So here in the Czech Republic, according to law, we can offer you the treatment just until the 49th birthday. So the last day when we can offer you the treatment is 1 day before your 49th birthday. So you should consider it to come to us, not too late. Then another question. Is it worth it to have IVF with own oocytes at 45? What are the chances? So if you are 45 years old, this is more a question to the doctor, but in my experience, what the doctor usually tell to the patients, the chances are very, very low, and it's almost zero, because you should measure your AMH level. This is anti-Müllerian hormone level, which shows us how big is your ovarial reserve. This ovarial reserve is constantly decreasing, and after 40 years old, it's rapidly decreasing. So this is very important criterion according to what the doctor can tell you if the treatment with your own stimulation, with your own oocytes is suitable or not anymore, or if he offers you the egg donation. How to prefer, I answer another question, how to prepare for IVF. So if you decide to go into IVF, you can be pregnant naturally, you shouldn't postpone the decision, because if you want to use your own oocytes, then the time is rapidly running, and even though you should try to live your healthy living style, to eat healthy food, to do sport, to be relaxed, not to stress, we know that it is very difficult. So don't postpone the treatment, because the later you come, the worse can be the result. I can see that we have another question. How can I prepare for embryo transfer? What can I do? And after embryo transfer? So usually it's very general question, because at first you should know what kind of treatment you will have. So if you have egg donation treatment, you will be given special medicaments, and practically if the doctor after initial visit approves that you can start, normally it begins with the first day of your period. It means on the first day you start just with folic acid, and from the second day you start with estrogens. Of course, you get, as I mentioned already, such a sheet treatment plan where you can see what you will take for the medicaments in advance, so you will have time enough to get it in your country. You really don't need to come to us. Different story is about your own stimulation, because you will need hormone injections, and it might be difficult to get it in any pharmacy. So therefore it's necessary to inform us in advance that after you had already the initial discussion with the doctor, because we have to send you the prescription, or you can come to us to pick up the medicaments, so you have everything prepared, because when the period comes, it can be also during the weekend, and then you could have problems to get the medicaments immediately, because you usually start from the second day of your period. After embryo transfer, there are several things you can't do, and that's what you should do. You shouldn't do any quick movements. You shouldn't jump or playing any quick kind of sports, so no playing volleyball, basketball. You shouldn't swim in the swimming pool. No hot bath is recommended, just showering. There are many more, but you will be informed then when you come to us for transfer. Our team of coordinators will inform you in details. Yeah, I can see the question was regarding to egg donation. So if you want to have this egg donation, then the first task is to have the initial discussion with the doctor, because he goes through all your anamnesis, all your medical history and all the results, and according to this he decides about the treatment, what kind of medicaments you will take, when you will start exactly, and so on. Then you will talk to me, I'm coordinator, or to our team of coordinators. We speak many languages. We have here English-speaking coordinator, German-speaking coordinators. We speak also Polish, Hungarian, Italian. So you have big choice of languages. And we will describe you everything in details, and also we have to choose the donor. And herewith I come to another topic regarding the donor. The donors in the Czech Republic must be, according to law, anonymous. So you won't be given any pictures, but you get some information about the donors, such as year of the birth, height, weight, eye color, hair color, education, eventually if the donor has already children, and hobbies. So you have some information, and if you have more donors to choose from, then you can compare and decide according to your wishes or preferences. The donors are tested. It's not so easy to become donor, because they must fulfill many criteria. So, for example, they are tested for spinal muscular atrophy, connexin, karyotype, cystic fibrosis, of course, sexually transmitted diseases such as hepatitis or syphilis and so on. They must be in a good health condition, and they undergo also psychological interview and also interview regarding any hereditary diseases in the family background. According to law, the donor should be between 18 and 35 years, but our criteria are much stricter, so we choose the donors from 20 to 30 or 29 years old. So I can see we have another question. Do we need a letter from the clinic to show at the airport that we are coming for treatment? Do we need PCR tests upon arrival, or can we just show our vaccination cards? Now, if you are vaccinated, you can travel without any problems. If you are not vaccinated, you should, or we would recommend you to do the PCR test, because sometimes the patients tell me that they weren't checked on the borders, but it could be coincidence, so we definitely would recommend it. And also, please, when you currently would come, check the pages of Ministry of Foreign Affairs or the Czech Embassy. How are the criteria for entering the Czech Republic at the week or month when you decide to come to us, because nowadays, as you know, the situation is changing the whole time, and in autumn it can be worse again. So please check it as well as we check it. And also it can help you with, of course, can send you such a confirmation letter that you undergo the treatment in our clinic. It worked very well also the whole last year. During the toughest lockdown, when we sent this document, all our patients came without problems through the borders. So then I have here another question. Can we have in one IVF cycle 2 embryos transferred, one with donor eggs and one with own eggs? So transfer of 2 embryos from different sperms is not available. This is not possible. And regarding 2 embryos in general, we always recommend to transfer just 1 embryo. The doctor during the initial visit will explain you the risks, but it's always up to you and discussion to doctor. But in general, we recommend 1 embryo. IVF with donor eggs. Yes, this is what we offer, and we have several programs and several ways of guarantee. If you are interested to get detailed price lists and information and so on, please write us and we will send you all the information into email, because it's very detailed, and then you can read it everything at home and think about it. Okay, then I have another question. What is the waiting time? Actually, there is no waiting time. Now maybe just during the summer, when there are some doctors on holidays and so on, there might be a little delay, but otherwise there is no waiting time for initial visit and no waiting time for starting the treatment. The only thing is, if the doctor gives you a homework that you should do some other examinations, such as ultrasound, for example, if you have remotely Skype conversation, then you have to do it and send us the results. We consult it with the doctor, and doctor decides when you can start the treatment. Okay. Then, what tests and preparation is recommended before starting treatment for IVF and donor IVF? So we will send you all the list of examinations what we need from you before you have this initial visit, and is practically very similar no matter what kind of treatment you have, because the doctor always has to consider all your anamnesis. So it's always the best if you send us as much as you have from these medical results. For example, hormone levels, blood tests, blood groups from your partner, Permeogram results, hematology. If you have also some genetical examinations, you can send everything to us. We will set the file for you and the doctor can go through all the results. Are there any restrictions for traveling? We were speaking about it already. In the moment there are no restrictions, but still we recommend to have this PCR test. Usually your visits doesn't need to be more days. You can just come for one day and go home again. There is not necessary that, for example, after transfer you spend a couple of days here in the hotel. It's not a must. Just if you want to prolong the stay from egg retrieval and until the transfer, you can have holiday here and to watch the surroundings, to make some trips. This is possible. Otherwise, after transfer, you can leave immediately and go home. You can go by car, by train, fly. After transfer, everything is possible. Okay. So, another question, what is the split by countries? So, I would say that around 30% of our patients are from the Czech Republic, then approximately 25% are from Austria, 15% from Hungary, Polish people are about 10%, Italy 5%, Germany 5%, but I'm speaking now about Brno clinic. In Prague I think it will be different because it's near to Germany, and also there are more people coming by aeroplane, so it might be different. So then I have here another question. What is the success rate of IVF treatment with PGT-A tested frozen embryo in our clinic? So I must tell that PGT-A method actually is not increasing the success of being pregnant, but it's suitable for the choice of healthy embryos. So if you have, for example, 5 embryos on day 5 and you want to test them, it shows after this PGT-A if the embryos are healthy, euploid, so if they can develop further, so you can avoid transfer aneuploid embryos, so it just would decrease the number of transfers. And the probability is influenced by your anamnesis, which is individual, and also by age, of course. If you want to see any statistics, please look into our page, on the web page. It is written. Do we need PCR tests and a letter from clinic with a reason for our visit? We mentioned this also. If I have a connection from Canada to Czech Republic, what is the procedure about COVID testing? Is there more? I haven't got any information about it, but I think it is the same if you are vaccinated already. You shouldn't need anything, but again, please check it on the Czech embassy if there are any other restrictions or rules for entering the Czech Republic. Do you provide blood type of the donors? Does the blood type need to match the career? We can give you or tell you the blood type of the donor, and usually it should be similar or the same as the recipient's blood group or the partner's blood group or the result that can be created by this combination of these two blood groups. Then we have another question. IVF, does it have a specific age? And what about women over 40? Are they able to do IVF? Of course, they are able to do IVF if you mean your own stimulation. This is possible. However, as I mentioned already, you should do all the blood tests, especially AMH test, anti-Müllerian hormone test, which shows you your ovarial reserve. It means how many oocytes you have still and how are the chances to be pregnant with your own eggs. You would discuss it with the doctor and the doctor would tell you how is the chance. But as already also said, after 40 the chance decreases rapidly, so please don't postpone the decision to order for this initial consultation with the doctor. Another question. How quick the donor is chosen? Does it take days, weeks? It is very quickly because we have quite a big database of donors, so you don't need to wait. Practically after the initial consultation, you will tell us when you would like to start. If you want to start with the next period, if the doctor tells you, yes, we can start immediately, then we are able until start of your period to find appropriate donor. Okay. We offer also not just women as a donor, but also donated sperms, and the conditions are the same, and you will be informed about the same information as in female donors case. Yeah. Wow, what? I don't have any eggs and my husband doesn't have good sperm, so we need double donor. And my NCAR function is too high, so I had intralipid infusions and there is written several medicaments. Unfortunately, I had negative test. What can we do? Could you help us? Thanks, Monica. Monica, thank you for your question. This is very specific and I would recommend you to order to our doctor for the initial discussion, because he must go through all your medical history and anamnesis to find out where could be the problem. I can see another question. How high should be the AMH over 40 years to have a chance? This is a very good question. However, it should be answered by our doctor, because it is not just about the height of this anti-Müllerian hormone, but also about the quality of your eggs. So you can have even, I don't know, the doctor says that if it is above 0.5, there is a still chance. So it means that you have actually quite a good capacity of the eggs, but another question is how is the quality? and this is something that we are not able to evaluate. We will see then during the stimulation. But this is really specific question that the doctor should reply and answer. Okay, what I wanted to tell you more. Yes. If you have this egg donation treatment, you inform us that your period started. We sent you updated the treatment plan, and you are taking the medicaments day by day, and between day 10 and 12 of your period, you go for ultrasound examination in your country, because we need to see how your endometrium reacts, how high it is, and if it's triple line structure. This is very important then for transfer, so the embryo can nest very easily. You send us the results, and then when the donor is ready for egg retrieval, we will inform you. You should know that we don't know it in advance, because in every woman it's different. So approximately it could be at the 15th day of your period, plus minus several days. So you are informed always just a couple of days before that will be the egg retrieval, so that your partner has to come for the sperm giving, and 5 days later usually is the transfer. Here is another question. Can you translate that on some other languages, please? Well, tomorrow we will have another broadcasting in German language. I will be telling the same information, so if you speak German language, you can watch us tomorrow. Otherwise, if you have questions, please write it below into the comments. If you have any questions also in general, you can write us. The doctors speak English, German, Russian, and our team of coordinators, as I already mentioned, English, German, Italian, Polish, and Hungarian language. In Prague, also Serbish and French. Before you come to this initial visit or before you have initial consultation, you should get measured, as I already mentioned, TSH and prolactin level, LH, FSH, estradiol level, and AMH. Then you should do also pap test, mammograph examination, your partner detailed Permeogram, but it's good to mention, if you come for personal consultation, you can have the Permeogram here, and if you are interested, the sperms can be cryopreserved here, so your partner doesn't need to come at the day of egg retrieval if the sperms are okay. This is also very good, very important to mention. Then we will do also STDs tests in case of own stimulation in female side or so in male side. If it's egg donation, then just on male side, because we are working with the biological materials. So according to the Czech law, it has to be done here in our clinic. We have the question if this broadcast will be also in Italian language. I will ask the director. I'm not sure, but maybe. We will find out and we will reply to you. Yeah, and another question. How long should I wait to try again after unsuccessful cycle, and what should I do? If you, after transfer, usually 2 weeks later, you do the pregnancy test. If this test is negative, we recommend always go for blood test yet, because the blood test is more precise than from urine, and then we see. If this confirms it's really negative, then you stop all the medicaments, and in about 2 or 3 days comes the period. If you want and if you feel okay, you can start and go directly into cryo-embryo transfer if you have here another frozen embryo. This is possible. Or you can have a month or 2 break and start later on. It depends on you, how you feel, because it's very important that you shouldn't be stressed. You should be relaxed. I know it's very hard to achieve, but try it, really try it, because it's half of the success that you are not under the stress. We always try that the whole treatment goes without any stress, but of course I know that if you are traveling and so on, there might be some complications, but try to avoid and try to do yoga, for example. We offer also some holistic methods, so yoga belongs to it, so you could try it. We also offer acupuncture at the day of transfer. If you wish, you should tell us in advance, because we have to order this acupuncture lady, but this is also the possibility how we can support the transfer. Otherwise, what should you do? It's always individual, yeah, because the cause why it wasn't successful, it's always different. Sometimes we can recognize, sometimes not. So it's always necessary to talk with the doctor or through the coordinators, and the doctor can suggest something that you can do for the next transfer to improve the chance. What is the waiting time? We were speaking about it already, so there is no waiting time. You can start and whenever you want. Can I go after embryo transfer directly to work? It depends, of course, what kind of work you are doing. If you are sitting in the office, it's absolutely no problem. But if you are working somewhere in the factory and you are lifting many kilograms, then we wouldn't recommend it, because you can't do any physical big strain. So you should wait until the pregnancy test, and then you will see. How many embryos you can transfer during transfer? So we always recommend to transfer just 1 embryo, because if you get 2 embryos, there is a risk that you could expect finally 3 children, because some of the embryos can split, and also the embryos or the children afterwards, when they are twins, for example, they are usually you give the birth earlier than it should be. So there might be some risks that we would like to avoid. So we don't recommend to transfer more than 1 embryo. So I haven't got any other questions by now so far. If you have any other questions you would like to know, please don't hesitate to contact us by any way, that by email, on Facebook, by phone, as you wish. We will try to answer all your questions and we will welcome you to our both clinics. Thank you for your attention.